We now welcome Dr. Sean Sullivan, a family physician who practices comprehensive family medicine, as well as providing care to the 2S LGBTQ+ population. Dr. Sullivan will update us on the status of an important topic in sexual and public health and discuss how we can all help end stigma. Bienvenue.
Pandemic. A pandemic is an outbreak of disease over a wide geographic area. Pandemic, a word we are all tired of hearing. Throughout human history, we've been faced with outbreaks of infectious disease. And for all of us here, we're no strangers to the uncertainty of facing a new virus, the anxiety of not knowing how it's transmitted, how best to protect ourselves, the fear of worrying about our loved ones, and the hope that one day things will go back to the way they were. But tonight, we're not going to talk about the pandemic that's the elephant in the room. We're going to talk about another one many of you probably don't know much about, a pandemic that's been going on for 40 years. But to figure out the status of where we are now, we have to start the story in the past. So imagine it's the 1980s, and you're living in a big city, maybe Toronto or Montreal. Things are good. You maybe just started a new job or you're finishing up school. And then all of a sudden, young, healthy friends of yours are suddenly getting sick. They're being stricken with sicknesses and diseases that doctors would usually see in the elderly or people with weak immune systems. They're breaking out in tumors on their skin and rare pneumonias. It just so happens that your friends are gay. Now, there was a lot of fear early on. No one knew what this disease was or how it was spread. There were no effective treatments, and almost everyone who was infected died. We're talking about HIV. Now, since the 1980s, there's been a lot of medical progress, and HIV is now better prevented and treatable. However, many of us still don't know much about HIV, how it continues to affect people, and how far we've come. People with HIV still face a lot of stigma, and there's a lot of fear of the disease. And why is that for something that's treatable and preventable? For part of the reason is because for a lot of people who were around when the pandemic first started, HIV is associated with severe illness and death. In addition, we don't usually talk about sex or sexually transmitted infections in public, tonight being the exception. And HIV also primarily affects minority groups, gay and bisexual men, transgender women, Black and Indigenous people, people who do sex work, and people who inject IV drugs. And the other reason I think there isn't more understanding and knowledge is simply because for most people, HIV is invisible and they don't know anyone affected. But HIV is still very much around. There are currently 38 million people in the world living with HIV. That's equivalent to every single person alive in Canada today, every single one of us. In 2018, there were 62,000 Canadians living with HIV. A few months ago, I was rounding in the hospital on one of my patients who was admitted for another medical reason, but who happens to have HIV. And I looked at the front of the chart, and in red ink on the summary, it said HIV positive. And I paused and I thought and reflected on the fact that although HIV is treatable, that label and HIV positive remains with the patient, and the virus doesn't go away. How does that impact the way their healthcare providers interact with them? How has that impacted their relationship with their friends and family? How does it impact their dating life? Now, as a family doctor who works with people living with HIV, as well as who practices to help lower the risk of people contracting HIV, I wanted to share some of the successes and the advances we've made with you tonight. But first, a bit of background. This is HIV, the human immunodeficiency virus. HIV is spread through the exchange of fluids, certain fluids, blood, semen, vaginal and rectal fluid, as well as breast milk. But it is not spread through touch, it's not spread through hugs and kisses, and it's not spread through speaking moistly. You can't catch it from a toilet seat or a swimming pool, and you can't catch it from a mosquito bite. Most people who get HIV today is from sex or injection drug use. Now, when someone comes in contact with the HIV virus, it enters the bloodstream and attacks an immune cell. Once it does that, it takes over the machinery of that cell and uses it to create more virus, which then are released, destroying the cell. This happens over and over again, and as that happens, the immune system is basically destroyed. At that point, people can't fight off infections, and we call that the acquired immunodeficiency syndrome, or AIDS. Early on, the progression to AIDS was almost inevitable, until the 1990s, when we developed antiretroviral therapy. These medications were the first effective treatments for HIV, and they act to prevent that virus from attaching to the cell and replicating itself. Now, for the first time, we gave these medications to patients, many of whom were almost near death, and they made a dramatic improvement, many of them feeling and looking healthy again. Some people called it the Lazarus effect. It was so dramatic. For the first time, these patients weren't facing a death sentence. They actually had hope. And since then, HIV treatments continue to improve so that they have way less side effects than they used to, and most people can take one pill a day. One of the other really exciting things we realized is by treating HIV, not only do we help that person live a long, healthy life, but we also help prevent transmission. And we call this U equals U, undetectable equals untransmittable. And what this means is for someone with HIV, when they're on effective medication suppressing the virus for up to 6 months, they have a 0% chance of transmitting HIV sexually to someone else. 0%. That's huge. And as you might imagine, that's a big part in reducing stigma towards these individuals, as well as giving them peace of mind within their relationships. Now, you might say, we've come so far, why can't we just cure it? The virus is tricky, and it mutates often, and it tends to hide in our other immune tissues like lymph nodes and spleen. So even though we can suppress it, if they stop their medications, the virus would come back. And although we don't have a cure, we've also made advances in terms of prevention. So one of those, in addition to condoms, which you're familiar with in U equals U, is PrEP, pre-exposure prophylaxis. What this means is someone who's HIV negative but has a risk factor for contracting HIV can take a medication once a day, and that lowers the risk of contracting HIV 74% through injection drug use and 99% through sexual contact. As you might imagine, this lowers the fear of contracting an incurable disease and has had a huge impact. Now, all of these advances that we've made in the past 40 years started with activists, advocates who pushed for progress and publicly fought so that people would acknowledge HIV and find treatments. Brave men and women with HIV, community members, their families, as well as scientists and doctors. Now, currently, we've come a long way in preventing HIV and treating it, and most people with HIV live lives similar to people who don't have the disease. But we have a long way to go. There's still no cure, and people with HIV still face stigma. In addition, HIV disproportionately affects people in low-income countries where treatments aren't as available, as well as minority groups here in Canada. So now, just like those advocates 40 years ago, you here and online can have an impact to help improve the life for those living with HIV as well as those at risk. My hope tonight is that you, people passionate about science, can use your influence and advocacy to drive change. Maybe not marching on Health Canada or the FDA, but small things. So breaking down stigma towards HIV and STIs when you hear it. Getting tested. 13% of Canadians who have HIV don't even know it. Promoting sexual education in our schools so that young people have the tools and knowledge to keep themselves safe. Supporting public health and publicly available medications to prevent and treat HIV. Promote harm reduction, needle exchanges, safe consumption sites, as well as good treatment programs for those struggling with addiction. And consider supporting local or international agencies that help lower HIV stigma and fight for a cure. Now, we've discussed the status of the HIV pandemic tonight, how it's gone from a story of devastating loss to one of hope, how a disease has gone in most of our lifetimes from being a death sentence to a manageable chronic disease. But I hope that you will join me in hoping that one day very soon we'll be speaking about a vaccine and a cure for HIV so that we can be celebrating the end of yet another pandemic. Thank you.